This Focus on Health segment is brought to you by Aurora Health Care.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Health Center in Oshkosh and we're in the Healing Garden. And there's no better place to talk about seasonal allergies with the trees and shrubs blooming. So let's talk a little bit more about those seasonal allergies. And joining us now to discuss allergies is Dr. Anita Gheller-Rigoni. She is an immunologist and allergist here at Aurora. And Doctor, thanks for joining us today.
Thank you.
Let's start by talking about allergic rhinitis. Did I say that right?
You
rhinitis?
Did. Perfect. Well, rhinitis, really generically speaking, is just inflammation of the nose. And when we put the word allergic in front of it, it means that you have a sensitivity to something in your environment causing you to have the symptoms that occur with allergic rhinitis.
Okay. Well, I think I've experienced some of the symptoms, but why don't you tell us what some of the symptoms are of allergic rhinitis?
More commonly, we consider like runny nose, congestion, itchy nose, repetitive sneezing, often eye symptoms like dry eyes or tearing. But things that people don't think of is oral allergy syndrome or certain fresh fruits and vegetables that can cause itchy throat, itchy mouth when you're eating them because of the cross-reactivity of those foods with the pollens you're allergic to.
Okay, now, can this develop at any age, or is it pretty much if you have it as a kid, you're always going to have it, or if you don't have it as a kid, are you free?
Yeah, no, it's a common myth that if you don't have it as a child, you can't have it as an adult. But there are two ages that allergies tend to develop, one in early childhood and then again in early adulthood. But it can happen at any age.
Okay. How does an allergist like yourself go ahead and treat something like this?
We usually start with a really good history, and often by that I can tell you what you're allergic to. And then we do various testing, skin testing or blood testing, and then from there we decide what you're allergic to and how you can avoid things in your environment.
Okay, now allergies and asthma, is there a connection there?
Well, that's a good question. We haven't proven that allergies cause asthma, but we do know that people with asthma, up to 50%, also have allergies. And so we know that by treating the allergies, you often improve the symptoms of the asthma.
Okay. When should a person consider seeing yourself or another allergist?
Well, if they have any of the symptoms I mentioned to you, but oftentimes we forget that because of the nasal inflammation, we can get recurrent sinus infections or ear infections, and those individuals should also consider maybe it's allergies that are causing these problems.
Yeah. And now that it's spring and summer is coming upon us, is this where you're usually busy throughout most of the year? Is this the big time of the year?
Yeah, this is the biggest time of the year, and in the fall when ragweed and the molds start pollinating, those are also busy seasons for us, but we keep busy throughout the year.
Well, some people deal with itchy skin. Now, could that be allergy related as well?
Well, something called eczema, which presents usually as itchy, often dry or red skin, is very commonly associated with allergies. And around 30% of people who have eczema could have either a food allergy or an environmental allergy that's triggering or increasing their symptoms. And we can also look at that, diagnose it in the office, and teach you how to avoid things in your environment, as well as to care for the skin to help alleviate those symptoms.
All right, so but the best thing to do is if you're having a problem with the runny nose, the eyes, or itchy skin, maybe come see you.
Yes, and we will help to both diagnose those problems as well as to help you avoid things in your environment to improve your symptom control.
Okay, well, thank you very much for joining us today.
Thank you.
If you'd like to know more about seasonal allergies or to schedule an appointment with Dr. Gheller-Rigoni, call Aurora Health Center in Oshkosh at 920-303-8700. I'm Ted Stefaniak. We'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Health Care.